Hey, good morning, it's Mark. I saw a study, a report of a study that was funded by CMS. It was run at a hospital in New York State. I think it was one of the Mount Sinai hospitals. The study involved a demonstration project and a control group. And the point was to take patients who were transferred after their initial care at a hospital. These were not surgical patients. These were medical patients. And as opposed to putting them in a bed in the hospital, they were put into a bed at their own home that was then monitored by hospital nurses. They had physician visits there. And the point was then to see how those patients fared. Interestingly enough, this hospital bed at home halved hospital readmissions versus patients who were treated in a hospital bed and then released and then discharged. So post-discharge halved the number of readmissions, and it also halved the number of those patients who needed to seek care at an emergency room following their eventual discharge. So discharge from hospital bed at home versus discharge from the hospital. You can imagine what the cost savings here are. Two layers, both the initial care, hospital at home, being much cheaper than hospital in a hospital, plus the huge savings from the reduced number of readmissions and reduced number of ER visits. So, in blog posts and probably some of the Wisdom Applied videos on the YouTube channel, I discussed in the past the way that hospital care is going. Surgery is the engine of hospital profitability, but more and more surgeries are flowing out to surgery centers, and as technology increases and as CMS catches up with CPT codes enabling procedures to be added to the ASC fee schedule, more and more cases, surgical cases that could be done hospital inpatient will now be done outpatient, and if they're going to be done outpatient, because ASCs are about 85% or so cheaper than HOPDs, those cases are going to ASCs. So hospitals are being gutted of surgical procedures. That leaves medical procedures. And if medical procedures can, in essence, be treated at a hospital bed at home, for less money than a hospital bed in a hospital, that too is going to eventually gut more and more of the reason for the existence of hospitals as we know them. What this is going to mean for hospitals themselves, which will exist only for the sickest patients, and unfortunately those are also the poorest, is yet to be seen. What sort of funding will exist for them? How many of them will simply be mooted in terms of their reason for existence, so that we'll have a far smaller number of hospitals. This will also impact many medical specialties. It'll impact employment in healthcare fields, not just physicians, but in nursing and in other sort of paraprofessions. Where all this goes, I don't know, but I know that it's not going to the hospital.